given that I just had half an hour of time, one of the things that I'm assuming is that you guys all take care of ADHD all the time. So we have not talked about any diagnostic issues. If you need help with that, the AAP's ADHD toolkit is great in terms of walking you through the diagnosis. I like to use the Vanderbilt both because it helps with very easily tracking whether kids have sufficient symptoms in each category and also looking at for other associated problems. But it's most helpful when you go, after you've collected all your information, to then sit down with the parent and explain why you're making that diagnosis, because it is a judgment call. And you can literally walk through the Vanderbilt and help them understand why it is that you're saying that they have the diagnosis. I was thinking back about sitting down, I was thinking about the question about the movement device, you know, where it's measuring movement. One key part of an ADHD diagnosis is whether or not the symptoms actually cause functional impairment, whether it gets in the way of the kids functioning at school, at home, and with peers kind of things. You know, so a movement device isn't going to give you any of that kind of information. You need to have specific documentation that the kid's symptoms are getting in the way of his functioning kind of thing. Because there are lots of wiggly kids where they function just fine, and it doesn't get in the way of those things. And those kids don't need treatment. They need the world around them to not expect that everybody has to be sitting primly with hands folded on their desk kind of thing. In terms of planning intervention, one of the tricky things is there are the core ADHD symptoms, but in many ways the bigger impact of ADHD is the things that track along with it. Particularly commonly associated are school performance problems, disruptive or oppositional behaviors, conduct problems. So oppositional behavior or conduct problems happens with probably half of the kids with an ADHD diagnosis. Almost a third have anxiety problems, certainly 30%, but many people think it may be higher than that. Including many of the ADHD kids who have sleep problems is probably more closely related to the anxiety problems that are tracking along with it. And the number of kids who have depression ranges from 20 to 60% or more, depending on which study you look at, and some of that depends on what age kids they're looking at. So the older kids tend to have more depression symptoms. The younger kids usually have less depression symptoms. There's one study that's really good in terms of thinking about the school performance problems of kids with ADHD. It was done by the Mayo Clinic, and it's a very unusual study in that they got a large pool of parents to agree at the point where the child was born that they would participate in this longitudinal prospective study. And basically the parents agreed to give the Mayo Clinic team access to all of their school records, all of their health records, all of their doctor's visits, all of their emergency room visits, all of that kind of stuff for 21 years. They also got access to some of the parents' records in terms of mental health treatment and substance abuse treatment and things like that. So they were able to track a lot of things, and then they took that large database and pulled out pieces of it. So in that database, they looked at 370 children who had gotten an ADHD diagnosis at some point during their early school years and compared them to 740 kids without an ADHD diagnosis who were matched in terms of gender and age and things like that. And they found there were much lower median reading achievement scores among the ADHD youngsters. So that was the achievement was 45 in the ADHD group versus 73 in the non-ADHD group. The ADHD group was 3 times as likely to have repeated a grade by the time they were in late middle school, and they were 2.7 times more likely to drop out of school. They also then looked at if those kids got medication treatment for their ADHD, what impact did that have? And they found that it had a modest improvement in reading scores. And that's been something that's been difficult for people to document whether or not that helps, but this certainly is one situation in which it didn't fix reading problems necessarily, but clearly they had less reading problems than the kids who had not been treated with medicine. They were 1.8 times less likely to repeat a grade than the ADHD kids who were never on stimulants. So it made a big difference in that, and that's probably, some kids repeat a grade because of academic stuff, but some kids repeat a grade because they were so disruptive that the teachers convinced they couldn't possibly have learned anything. So it cuts down on that. It unfortunately did not change the dropout rate, which is too bad because dropping out is a major problem with these kids. In terms of intervention, at the tail end, I'm going to spend a very brief time talking about medicine, but mostly I'm going to talk about the non-medicine things that you do. And one thing that's important is the whole pool of non-medicine things you can do for a kid who meets the criteria for an ADHD diagnosis, but you can also do it for those kids that don't meet the threshold for the diagnosis, but they're still having difficulties. So I see some kids where instead of having 6 of 9 symptoms rated substantially, they're down at 5. Well, I can't make the diagnosis with that, but clearly, if they're being rated as having significant problems with 5 out of 9 symptoms, they're struggling with some things. So those kids often benefit from the non-medicine interventions. And those include educating about the disorder, identifying the specific problems the child has, and targeting those. So if you have a kid who's not hyperactive, you don't want to do strategies to help a wiggly kid because that's irrelevant. Making use of behavior plans, and you learned some about behavior plans last time from Dr. Heisler in terms of how to set those up. Pointing out successes and figuring out why the child was successful, and encouraging schools to develop appropriate plans. In terms of educating about the disorder, it really helps for people to think about what this child can do and what he can't do. I do a lot of work with schools, and it drives me nuts when they create behavior plans for calling out answers. Because an ADHD kid who's overactive, not on medicine, is going to call out answers, and he cannot control that. So it's great that you want to do this, but I asked the teacher, do you really think this is something he can change? Well, no. Okay, maybe we need to come up with another strategy, or the being out of a seat kind of thing. If you have a really wiggly kid, that may not be something that he has capacity of controlling, even with the world's best behavior plan. You might, once he has some medicine support, he may need a behavior plan to help control it then, but you have to be realistic about what a kid can and can't do. This is not an excuse not to follow rules. So we talk about the fact that the kid needs to follow the rules, but you might modify the punishment if you thought that he really couldn't control things. And again, I do a lot of work with schools, so one of the things I talk with schools about is to separate out. If you have, and the worst example is there were 2 kids that I was involved with in a short space of time. One kid was a middle schooler who'd been in school, and one of his friends said, oh, wouldn't it be neat to light the trash can on fire in the bathroom, and here's some matches. And the kid went, oh yeah, that'd be cool, and lit the trash can on fire. The other kid thought, I'd like to disrupt school, and he was the one who brought the matches to school and lit the trash can on fire. Well, the kid where somebody suggested that he do something and he did it impulsively, he clearly needs some consequences for that, but they'd be very different from the kid who did the planning. The kid who did the planning, that wasn't his ADHD did that. That's a whole different story. So that kid needs the full punishment that you would do for causing a fire in school, while the kid who acted on somebody else's suggestion without stopping to think, he needs a consequence, but maybe tossing him out of school for the rest of the school year would not be appropriate, kind of thing, because he didn't consciously plan to do that. And the other thing that's really important is to be proactive. It's really important not to have these kids play out the misbehavior they're starting to do. So if you can anticipate that something's going to happen, and redirect the kid to do something else, so that he doesn't build up a behavior pattern of misbehavior, that's far better than playing out the misbehavior and punishing it. So the teachers, for instance, might be sensitive to, Johnny's getting a little wiggly, oh, I'm going to ask him to take a message down to the office, rather than escalating to do something that I don't want him to do. Now, you don't say, oh, I'm sending you down to the office because you were about ready to do something. You do it so that the kid doesn't realize that's why he's going down to the office. But it then will, then he got the thing that was about ready to happen didn't happen, and he got his wiggles out, and that will often break up the whole behavior pattern. So again, it's important to identify the specific problems and then plan strategies to minimize those problems. So when the families come in, ask them what their concerns are and design your plan with that. Some families are going to need help with sleep, some families aren't. And so you want to tailor it to what their specific problems are. And those supports should get matched to those. So for instance, if you have a wiggly kid, then extra opportunities for breaks or movement may be important. There are other kids that have a very hard time getting started at something, but then they have a hard time stopping it, you know, kind of thing. So telling that kid, oh, it's 10 minutes into your homework, you have to stop and take a break, would be the wrong solution, because quite frankly, when you finally get them engaged, they might as well finish it up. You know, so you've got to look at the specific kid and tailor it to that kid. Organizational support is really important. Cutting down expectations so that people have something that's reasonable is important. Extra adult supervision. I can't begin to tell you how important this is. You know, if a parent knows that a kid needs extra support, they should do that. You know, so some kids at 6 can go outside and play all by themselves, and other kids can't. And if your kid is one who can't go outside and play by himself, then the parent should recognize that they need to go out, even if the other 6-year-olds don't have a parent out there with him. That's far better than sending your kid out to play and having him down the street and in traffic kind of thing. So that you have to be realistic about what's appropriate. And again, the anticipating and redirecting is a really important strategy to teach families and tell them that that's appropriate to do. I talk to lots of families who talk about grocery stores as being especially difficult. And almost invariably, what happens is that parents have built up this pattern of they hate taking their kid to the store, so they don't go to the store. So the point at which they need to go to the store, they're out of everything, so they need to go down every aisle. So they would do far better either to get a sitter for the kid while they go to the store and do that, or alternatively make 3 trips to the store and each time go down 2 aisles. You know, so almost always those kids could be fine in a store for 15 minutes. They just can't be fine in a store for an hour. So being realistic about things. Behavior plans are important because they provide extra structure for youngsters. It's really important to keep the goals small, 3 or less. And quite frankly, if you're talking about a plan for a kindergartner or a first grader, 1 goal is probably the right number. Again, I often go into schools and find them giving a kid 6 goals. And what happens is if you have 6 goals, you don't do any of them. While if you have 1 goal, in the process of meeting that goal, you'll actually do the other things better too. One of my kids who's not particularly talented in terms of sports, loved playing sports. And my tendency was to, as she was going off to play a game, was to tell her, okay, remember to watch where you are on the field and keep your eye on the ball and, you know, do something else kind of thing. And it was my husband who was really skillful at saying to her, what one thing are you going to work on today? And they might agree, I'm going to work on field position. And when she did that and worked on just one thing, everything got better. It was a far better strategy about how to approach it. If you're going to have several goals, what you can do is highlight one goal to give double points to. Is another way you can accomplish that same thing. And you have to get the reward at least 75% of the time for the kid to buy into the plan. So I saw a kid last week who I asked, oh, does he have a behavior plan at school? Oh, yes, he has a behavior plan. Okay. So I asked the kid what he gets if he's successful with his plan, and he didn't know, which was one of my tip-offs that we had a problem. And so then I said, well, and he'd had this plan for a month. I said, how often have you gotten the reward? Never. Okay, that's not a behavior plan. You know, if he's never getting it, you know, that's a device that the school's using to say, oh yeah, we instituted a behavior plan, but it is not a behavior plan if he never gets the reward. So if the plan's not working, things to think about is maybe the interval is too long that the kid's being assessed. So that boy, his plan was set up so that he got his reward on Fridays. This kid could never make it till Friday with doing what he was supposed to do. So that was way too long. I've seen some kids where the reward is at the end of the day, and oftentimes that's too late too. And one of the things I'll point out to people involved is that means if he's had problems in the morning, that he has no motivation to be better in the afternoon because he's already blown his chances. And they do much better to make the reward, one reward at the end of the morning and then another one at the end of the day. And they can be a tiered thing. So it can be, his end of the morning reward could be something as simple as being the line leader to go to lunch, kind of thing. But there's something that acknowledges that you're on track, kind of thing. And then he gets to start over again, and there's another afternoon reward, and then there can be a summation reward, kind of thing. It sometimes helps. One of the other problems I run into is sometimes the intervals at which somebody's supposed to assess it is not something that comes naturally. So if the kid's being good, people forget to give them the points. And oftentimes that's because in our town, often Kennedy Krieger creates systems. And one of the things they'll do is say, oh, the kid gets points every 15 minutes. But that's not a natural time for people to get points. They do far better for the teacher at every time she changes subjects or topics to be giving the points, because then she's likely to remember to do it. She is not going to remember to give the points every 15 minutes unless she sets a timer for herself, kind of thing. Lowering the number of points it takes to get a reward is another way. Having different rewards for different numbers of points and more frequent rewards. One of the things that I think is really important is oftentimes you'll hear that a kid screws up and he gets grilled for half an hour about why he did such a stupid thing. And you know, he doesn't have a clue. He didn't mean to do something stupid. He didn't mean to mess up, and he doesn't know why he did it. So he doesn't learn anything from that. Far better, instead, is when the kid's successful to get him to stop and think about, why did things go well this time? What did you do? What did somebody else do to help you that made a difference, kind of thing? You know, so a kid who gets 100 on a spelling test, say, wow, that's great. Okay, so let's think about how did you prepare for the spelling test this time? What did you do, kind of thing? And come up with a theory about why that is, and then have him test out his theory. And it can be something he did, or it can be something somebody else did to help him. Oh, the teacher gave me a one-page study guide. That really helped. That's okay, because you could then turn around and say to another teacher, gee whiz, that really helped. Can you do that? Can you help me out with that? Or can I create the same for me? Sometimes you'll come up with some interesting things that you kind of go, really? But sometimes it's helpful. One of the kids I take care of, his mom came in and told me that he'd usually been getting 70s on his spelling test, and he came home with 100. And she asked him why, and he said, oh, you know why I think it is? Because I was driving you nuts bouncing my basketball in the kitchen while we were going over my spelling words. She was a very savvy mom, so she kind of went, oh, okay, well, let's try that again on purpose next week and see if you can get 100 again. And you know what? He did. And one of the things they learned from that is this is a kid that doing something repetitive and tactile at the same time he was trying to remember something helped him remember things. So he then started incorporating it in. Now, obviously, in class, he couldn't bounce the basketball, but he learned he could tap his hand on his leg and do the same and get the same kind of effect. So he learned something really important that was an important skill that he then was able to carry over, even though it started out being kind of a, oh, yeah, really? But he was right about that. So that kind of thing is helpful. Okay. In terms of school plans, there, at least in the metropolitan Baltimore area, there are kind of 3 levels of plans. One is informal plans that the school does, but are not on any official federal something or other. Then there are 504 plans and special education individual plans. So let me just talk about, so the informal plan, there's nothing wrong with an informal plan. And in fact, if that's what your school system's pushing to do, I say, great. One of the things I'll talk with them about that is the negative thing about that is there's nothing in writing that goes to the next year that says, we learned this is what helped this kid. So one of the advantages in doing a 504 plan is there's then a document that goes to the next year so the teacher's not starting from scratch. And so I'll often talk with them about the fact that it actually is useful to do some kind of a written plan when the kid's been successful. Usually what will happen is schools resist doing a 504 plan. They're saying, oh, but it's working now. And I'll say, okay, so how much stuff is the teacher doing? And if it turns out the teacher's doing a ton of stuff, maybe that needs to be put in a 504 plan, because otherwise this kid's going to fall on his face the next year. A 504 plan comes from the federal law for the Rehabilitation Act, thank you, and section of 504 of that. So the Rehabilitation Act is the act that says that we have to have curb cuts and sidewalks for people in wheelchairs, and bathroom stalls in public buildings have to be wide enough you can get a wheelchair in. Basically says that that public institutions need to make reasonable accommodations for people with disabilities. And they've specifically said that Section 504 says that kids who have a disability deserve to have reasonable accommodations so they can be successful. So that gets used when a kid's in a regular classroom and he's not getting special ed services, but he needs some special things done so he can be successful. And that can include things like extra time for tests. It can include shortening assignments kinds of things, or it could include stuff like having the kids sit in a particular place in the classroom, which might be in the front or it might be in the back, depending on, if you have a very wiggly kid, you don't actually want to put him in the front center where it distracts everybody else. You either want to put him in the back, but where the front to back distance is not too far, or over on the side where the teacher looking out doesn't automatically get distracted by that kid and the other kid is not distracted by it, kind of thing. So all of those kinds of things can be included in a 504 plan. Special education plans get reserved for kids who need special education services. So they need something substantially different, some substantial changes in the curriculum and how the kid is being taught. And that can be, ADHD can be the primary disability for that, but usually those kids either have significant behavior problems which require special things or significant learning problems as well. Some fraction of these kids, and again, studies don't agree, say that a fair number of these kids have specific learning disabilities, and that their educational plans need to address that. So those kids often need to have an IEP for that. Depression and anxiety, those things need both counseling and or some medicine specifically to address those problems. In terms of oppositional behaviors, it's really important that these kids have a limited number of rules, but you enforce them consistently and predictably. And that may mean telling parents to stop and think about whether something's really important or whether it's something you can ignore. Sometimes families have way too many rules, and that especially the ADHD kid is never going to remember them all. So sometimes it's useful to get it down to a core number that they can remember. It's important to have the consequences be immediate or as close to the infraction as possible. So the just wait till your dad gets home kind of thing is not a good strategy for what to do. You do better to have something, it doesn't need to be something very complicated, but something simple that you could do right away. And it's useful to think about natural or logical consequences. You know, so a kid who hasn't finished his homework maybe shouldn't have handheld device time or TV time that evening, kind of thing, and that can be a logical consequence that happens as a result of that. It's really important to avoid setting kids up, so preventing this behavior is much better than disciplining after bad behavior. Similarly, avoiding problem situations. You know, and I'm sure you all have had the experience of being in the toy store the week before Christmas at 10 o'clock at night and having parents chastising kids for misbehaving, and you kind of sit there and go, why do you have your kid in this very overstimulating situation when he's tired and or hungry, kind of thing? So you don't want to do that. And you want to redirect them early. It's also useful to have a way for a youngster to save face, so that to give a kid choices among things that are acceptable so that they can get out of a situation that they're in is a really good idea. And not that they have to say, oh, I'm wrong, and kind of thing, but give them a reasonable way out. And it's really important to give these kids positive messages. Adult messages are really powerful. So if an adult says, you're bad, kids think they're bad. If, on the other hand, they say, it's hard for you to sit still, so let's think about where you could be in the classroom and how you can get your wiggles out without disrupting things, that's much better. And that may be, it's okay to stand at your desk, but you have to stay, you have to stay close enough that you could put a hand on your desk at any time, kind of thing. And reframing into positives is also important. In terms of organizational things, use of routines is really helpful. A box by the front door and the path to the door for the things the kid needs to take the next day to school, posting what they need for the next day. Visual reminders are helpful, checklists, cues, kinds of things. Often ADHD kids benefit from color coding, the things like having a folder and your textbook covered in the same color. So when you go to grab stuff, you'll grab everything that's red, kind of thing. On projects and things like these kids often have a terrible time with projects. So they need a calendar, but they need to learn to, in their calendar, to make sure that they've added in time for either the project, I ran into some glitch, or I thought I was going to work on it that night, but there was something else compelling to do, kind of thing, and learn to plan to start things way ahead of time. Because oftentimes they'll say, well, I can do it in 3 nights, and they're right, but you shouldn't start it 3 nights before it's due. You do better to start it a week before it's due, so that, you know, if your best friend wants you to come over to his birthday party, you don't have to say, no, I can't come because I have to do that project. Binders with zippers. These kids are forever dropping stuff, and then everything's all over the hall or their room, kind of thing. So if they can zip the binder closed, that helps. We kind of talked about the and they need to reorganize their binders at least weekly, but maybe even daily, and make sure stuff's in the right place. The other thing is that I often run into kids who, they had a piece of paper, they didn't turn it in a given week, and then when they organized their binder, they threw out everything at the end of the week, and then the next week the teacher asks for it. So oftentimes it helps to have a designated box someplace where anytime they're going to clean out their binder, rather than putting it in the trash, they put it in the box. That means it's retrievable, kind of thing. You know, and then you can decide whether it's at the end of the quarter or the end of the semester or the end of the year. You're going to toss out everything. You're not going to need to sort through it. You can just toss the whole box at that point. And most people can find a place to put one box. You know, and then it means the kid's got a fighting chance of recovering from something. It gets very discouraging to these kids because they'll go, I know I did that, but I can't find it. Well, you know, hopefully it'll be either in their binder or in the box. I'm about out of time, but let me just say that medications have an important role. You could see that with the Mayo Clinic study, but clearly the NIH study said that, especially for school-age kids, many of these interventions are going to be most effective if the kid has medication support as well, and that without that, they may not be able to benefit from behavior plans or all of the other kinds of things. The specific medication choice is a complicated thing, but it's also something that you guys are really comfortable with. Let me just state that it continues to be true that a stimulant is the first, second, third, fourth, and fifth choice, and that even the newer things that have just been FDA approved are not that hot. You know, so they may be useful if you've bombed with something else, but they should not move up to be your primary thing that you try first. So the important things are to educate about the disorder, tailor the treatment to the specific child, treat coexisting conditions, use positive approaches, and recognize that medicine has an important role.